Good morning, everyone. We'll get started in just a few minutes. A few more people are coming into the waiting room and we'll let them in, and then we'll get started in 1 or 2 more minutes. For the lecture today, we'd like everyone to keep their audio and video muted. This makes it for a better playback and presentation for the presenter. We will be asking questions at a couple of times throughout the presentation. So if you have a question, you can type it into chat and I will read it off for you when it's time, or you could raise your Zoom hand. That's either on the participants list down at the bottom if you're on an older version of Zoom, or if you're on a more current version of Zoom, it's on the reactions button, which is on your control panel. And there's a raise hands button at the bottom of that reaction panel that pops up. Welcome everyone to the OLLI Medical Series. This is a weekly presentation where we invite doctors from the community to give us information and help us increase our medical literacy. Today's lecture is how to get the most out of your doctor visits. Many patients have difficulty getting access to their physicians and their medical records. There are time management issues and shared decision-making issues. Dr. Scott Smith will discuss these methods in place to resolve the issues. Dr. Smith is a family physician who trained at St. Louis University School of Medicine and UCI Medical Center. He has practiced in Orange for over 35 years. Family physicians have a wide spectrum of medical talent, including knowledge of common things that occur in patients in almost all other specialties. His practice included obstetrics, where he has delivered well over 1,000 babies. He has grown up with his patients, most of whom are now seniors like he is. Dr. Smith has been a medical director with the St. Joseph and St. Jude Heritage Medical Group, and also served on medical group boards, hospital boards, and as a scoutmasters with the Boy Scouts. During that time, he has learned from many great physicians, but he states that he has learned the most from his patients on how to be a good doctor, a good listener, and a good teacher. We look forward to learning what he considers a good way to get the most out of your doctor's visit. Okay, Dr. Smith, if you'd like to share your screen.
Let's see if that works. Hello.
Okay. Oh, you're on your presenter view this time.
Okay, let's switch that around. Let's see, over here, maybe. Does that work?
No, that's the presenter view.
I guess I'm just not that smart about this.
It worked fine in practice.
Okay.
Okay.
Let's see. Oh, I know why. Maybe if I move this over here and then we do it that way. I don't know. The trouble with practice.
Yes. Okay. If you end the slideshow,
and the slideshow. Yeah. Does that work now?
No, we're still seeing that. So would you like me to show the slides? And
Yeah, why don't you? I guess the only way we can do
okay,
this.
Let me stop your screen sharing. Just need to get it on the right screen myself. Okay, do you see the presentation up there?
Yes.
We're all there. We're all there. Okay. Well, welcome. I'm grateful to be here and grateful to be asked to present here today. One of my patients and friends was an OLLI member for many years, and I've always been fascinated by the concept of continual learning, no matter what age you are. And I think because I think it's important to keep our brains going and working properly. So I've been asked to talk about how to maximize the value in your doctor's visit. So I entitled this, um, prepare to learn to care for your health. So each one of those words I think are useful. The preparing part is that if you think about what you're going to do at your doctor's visit before you um, come in, then I think it is more likely that you'll get more out of your doctor's visit. Um, the idea of a doctor's visit is to learn from your doctor, to have him or her learn from you. And the whole concept here is to care for your health. And I know that seems odd, but we're not really, our main goal in medicine is to try to keep you healthy until the night before you die. And, if we can do that, we consider that, very successful. So next slide. I can't see what's on the screen, so let me see if I could do this a different way. Oh, there. Now I can. Good. So what we try to teach here is to get the most out of your doctor's visit by trying to engage with your provider. Think of him as a health coach, and try to have a question at each visit. We're going to talk a little bit about medication, what the theory of medication is, and why it's reviewed at your visits. Generally, we want you to know about your health and surgical and family history, and we're going to talk a little bit about that, and then understand that there should be a journey and a discovery that you both should go through and go on. So go ahead there to the next slide. Okay. So I assume that is the slide that says engage with your physician, right? So this
Yes,
is I still for some reason can't see exactly what you're all seeing. So viewing Bill Riley's screen. So anyway, we'll go on. So the idea is to say, is to be friendly with your doctor when he comes in, is to, say hello. I know that seems odd, but we have some people that are inhibited by the idea that they're a doctor. They're just people. They have one job, one set of training, and so that's important. In the world of EMRs and electronic medical records, one of the things that happens is the doctor Sometimes it has a computer in the room, sometimes doesn't, but it's important for you to orient your doctor to you. So, for instance, I've only seen you twice before today, and the last time we talked about my blood pressure. It's important because it focuses him. If you said last time we talked about my hip being fractured or whatever, don't assume that the doctor knows everything about your health every time he sees you, because there is many times when things happen with you, and doctors see 15 to 20 people a day, and it's hard to keep track of all the things that happened in the last 2 or 3 months since you've been in. So right off, it's very reasonable if something's gone on or you need to have them kind of remember who you are. It's very appropriate for you to orient your doctor. Now, this presentation is a little bit about primary care doctors, because that's what I do, and the visit that you have with your primary care doctor. But it can be adapted to specialists. Specialists often do quite a bit of primary care, but they sometimes are just there to do consultations for your primary care doctor, and they're really only there to decide if you need surgery or if you don't, or if you have this problem or that problem. They really don't want to hear about the rest of things. But from a primary care standpoint, your relationship with your doctor ought to be, what can we do for you today? And when he asks that, you need to have an agenda, the 2 or 3 things that you really want to cover that day, and then have a question about your health visit. Next slide. So we talk a little bit about agenda setting. This whole concept of the 3 things that you want to discuss. You ought to have some priority in the way you think about your health and what you want to have done with that visit. And then perhaps your question ought to be on that list. In my office, we use an actual sheet of paper. We ask people to fill it out. That's mainly so the medical assistant can put things on the computer for us so we can be sure to talk about everything. But as far as you're concerned, when you fill out that paper, you just need to be sure you've got the thing. Now, if you have 12 things you want to talk to them about, you're going to have to prioritize usually the top 3 most doctors can get through in a visit. But if you come in with somebody, spouse or daughter or son or something, then it's important to share that list with them so they can make sure that you get to all 3 of those things for your visit. This business about a question. So if you'll go to the next slide. Oh, excuse me. Let's do one thing about agenda setting. Also on that agenda is to be able to update him about him or her about what you did. So if you saw a specialist last time, between the last visit and this visit, it's to say, I saw the ophthalmologist and he made a different diagnosis than you made, or he explained my eye problem, or he says I need my cataracts out. Similarly, if you went to the ER for something or had an urgent care or even had the blood tests, again, if you have blood tests that were all normal, you don't really want to talk with them. You don't need to mention it so much. You can say, I had my blood tests, I reviewed them, they're all normal. That's good. But if you want to talk about them, then you need to tell them up front so that they can anticipate that. Similar about refills, and if you had a medication that you stopped, you need to remember why you stopped it. Was it because it caused you heartburn, or was it because you didn't like the way it made you feel, etc.? And then on there, be sure to ask the next most important question. So let's go to that question. All doctors have we're trained as in medicine with the idea of being teachers, and we teach each other, we teach our patients, and most docs just love to teach about what they know. So why questions are really good questions. So why does this pill help me? Or on the other hand, why do I get abdominal pain when I overeat? Or why does my hip hurt when I climb stairs, but it doesn't hurt when I go downstairs. Anything like that is an opportunity for the doctor to engage with you, teach you, have a discussion with you, and those are important. If you have specific questions, and I put 3 down here just as an example. Are you concerned about this medicine giving me long-term problems? Or another question could be, what can I do to help this pain, problem, or symptom? And then how does cholesterol affect my memory? One of the things that comes up a lot is the internet, and people use the internet in different ways. I encourage my patients to use the internet, not to go out of their way to do so, but simply to, if we make a diagnosis, read about it on the internet. If we give you some exercises, there's great YouTube videos on how to do certain kinds of exercises for your knees, your shoulders, etc. And so I always try to have people feel comfortable using the internet. You all know how to use Zoom, so there are presumably you know how to use the internet and get some information. What we don't appreciate as doctors is to have you go down, whether it be conspiracy things about medicine or the odd things. We're trying to have you use internet to learn about your disease from reputable sites. I always point people to the Mayo Clinic site. That they have a very robust internet learning clinic. And of course, it always ends with everybody ought to go to the Mayo Clinic for everything to come in and see the doctor. But nonetheless, their information there is very, very good. So next slide. So what I wanted to do right now is to pause for questions and see if there's some questions that has sponsored.
If you have a question, you could type it into chat or raise your Zoom hand. I'm not seeing any
No
hands
questions.
and
Okay.
no questions.
Okay, we'll go on then. So then the next thing I'd like you to think a little bit about is knowing your medicine. And generally what happens is that, doctors, one of the things we do is give away pills and prescribe medicines or treatments. That's what we do. We're trained to use these medicines, which generally have come from herbs over the years, and they've been concentrated and purified, and then they've been had lots of experiments done on it to show that they actually work better than a placebo. So placebo is a medicine that doesn't have any true medication. It might be, sugar or talcum powder or whatever. And then they compare that to the medicine. And generally the FDA requires that things work about twice as good as a placebo. So most placebos work about 20% for whether it's blood pressure, diabetes, or stress. About most sugar pills work to improve about 20% of patients. So for a medicine to meet the criteria to get approved by the FDA, it usually has to work twice that well. So let's say it's 40% effective at least. It could be like 90% effective, but most medicines are 40 to 60% effective at treating what they're supposed to be treating. And so it's important for you to have an understanding about why you're taking each medicine. Generally, doctors have lists of your medicines, and they'll write down, if you ask them, what you're taking your medicine for, or it'll be in the EMR and it'll be typed out as part of the record when you get a record of your medication. You should keep that list and the reason for the medication. So whether it be family, friends, you, or your doctor or your specialist, they understand why you're taking a medicine. Now, refills these days are part of your, getting the most out of your office visit. And what we want to do is try to maximize your time with the doctor talking, not just doing mechanical things that can be done by the medical assistant, et cetera. So the concept is these refills are managed electronically. And sometimes you say, I just need this refill. You need to tell the medical assistant or the doctor where you need it sent to. So I need it sent to my local pharmacy or my mail away pharmacy. And that usually is good enough so that if you get all your local prescriptions filled at a local pharmacy or all of them at a mail away pharmacy, the systems work such that you actually have to choose that when you're doing your refills. When you get a new medication, it's certainly reasonable to ask about side effects. In fact, it's encouraged. What are the most common side effects? Not the weird things that can happen, but what are the one or two most common things I should look for as I take this new medicine in terms of side effects? Now, side effects are kind of defined by if you stop the medicine, the side effect goes away. It's pretty clear that if the side effect is in time associated with when you started the medicine, then that's good. So I mean, it is you start the medicine, you have the side effect, you know that those two things are related. Risks of medicine are the longer term potential damage, and those are usually have to be balanced with your benefit. So the concept here is the one that it seems obvious, which is like, for instance, a blood pressure medicine may prevent something off in the future, but it may give you, it may be hard on your kidneys. And so you have to say, it hurts 1% of the people that take its kidneys, but it benefits 80% of the people by preventing strokes and heart attacks. And so you have to make that judgment with your doctor about what risk is better. And then the other thing you can ask them is how they're monitored. Is when I take this medicine, do I need to get a blood test once a year, twice a year, never? How is it that there's no long-term side effects? Once you've done that with a new medicine, you don't need to ask that every time, but certainly with a new medicine, those are very legitimate and good questions. So the next one. I have people who say to me, I need to be on less medicine. And I have people say, I need a pill for this or that. So it's incorrect to assume that less medicine is better. It's incorrect to assume that more medicine will help you. It's that balance between, the risks, the benefits, the side effects, and, frankly, the number of pills that you have to bother taking. Very few medicines interact with each other, but some do. The computers nowadays help us to know whether those interactions are significant or not, and whatnot. So I always quote this study when people say, I've got to get off medicine, and there aren't a lot of medicines. So there was a very famous Japanese study where they showed that they took people at 60 years old and then again at 80 years old and asked how many medicines they were on after 70. So they watched them for 10 years and then saw how many pills that they were on at 70 years old. And the answer to this question was the people that seemed to be the most healthy at 80 were on 7 different pills by the time they were 80. If they were on less than that, they might have perfect health and don't need any medicines. And if they were on a lot more than that, they tended to have poor health. Now, some of that's self-evident because if you're really, really sick, you might need more medicines, or if you're super healthy, you don't need any. But the point is that 7 different medications is not unusual, and it's not necessarily associated with poor health. So our job is to treat you with silver bullets, not hand grenades. That is, we want to give you medicines that treat one problem as much as we can. And we may need, and if you have 5 problems, we may need 5 medicines. We don't try to give you a medicine that treats everything. There are very few of those, but the point is that doesn't usually occur. We usually, if you have 5 problems, we usually have to have 5 medicines if you want to be treated for that problem. So then the next slide, if you would, this should say types of medicine. I think we're on the right slide, I hope. So there's 3 kinds of medicines we use. One that treats symptoms, and you need to think about this.
Hold on just a second, doctor. I hit the space bar and my presentation stopped.
Okay. You tell me when you're ready.
Okay, we're on types of medication.
Okay, types of medicine. These are the 3 categories of medicines that we use in general. There's always exceptions, but medications that treat only the symptoms you have. These are good medicines, whether it be Tylenol and Advil or cough medicine or cortisone creams or whatever. And those are for the symptoms. We don't try to cure anything. We're just treating the symptoms to calm things down, make life reasonable. The next set of medicines are medicines that modify your current illness. So that could be everything from diabetes to antibiotics to treating angina, which is chest pain from heart disease. Those modify your current illnesses and may help you. And then we use another category of medicine, which are prevention pills. And so these are medicines, and I'll say cholesterol treatment, for instance, or blood pressure are in both categories. But we might treat you with a statin cholesterol medicine to prevent you from having a stroke or a heart attack 10 years from now. This kind of medicine won't make you feel better today, might have a side effect from it, but it will give you a benefit about 10 years from now. 30 or 40% of the time, it'll prevent a stroke or a heart attack. Vitamin D for bones, immunizations, vaccines, asthma inhalers, even treatments like CPAP for sleep apnea are medicines that prevent future problems, not necessarily just treat your current problem. Okay, next slide. So then the next thing I'd like to talk a little bit about is how often you should see your doctor. So there's two things that are fairly new for seniors. In the last 7 or 8 years, Medicare has developed this thing called the annual wellness visit. And this is, you'll hear this term if you go in to see your doctor. It's often done by nurse practitioners and that, but it is a no-touch prevention visit. It's focused on updating your function rather than your illness. How do you do with your memory? How are you doing with your ability to go on walks? How are you doing with your ability to eat a good diet? Certainly we go over your current medical problems to some degree, but if we get into also having a medical visit, then it's usually 2 different visits either at the same time, or these are separated. We do prevention and have you come back for your kind of what you might call your physical or your exam or your concentrated visit about medicine and your medical problems. If you have no health problems, truly are on virtually no medicine at all, then I always suggest to my patients that they ought to do an annual wellness visit once a year, update their immunizations and their screenings and do all that at your annual wellness. And then one other visit during the year just to talk about, general health, look at the skin, check your blood pressure, all that stuff. If you have one or two chronic health problems, then usually the idea is that you ought to be in every 4 months. And then if you have 3 or more medicines or health problems, then probably every 3 months would be reasonable. Sometimes the doctor will want you to come in every month for a while until things get stable. Now, televisits are new, and they're new mainly because of coronavirus. And probably all of you have had a chance to have a televisit with your doctor. These are incredibly helpful because you don't have to come and sit in the waiting room, get exposed to other people is why we're doing it now. But it turns out that this has been a fairly good experience for most people. It's reasonable for you to have a televisit in what we've talked about here, probably half the time. So if you have to be seen 4 times a year, probably 2 of them can be televisits. So that's something that's new, and we can talk about that a little bit. Next. So family history is important. We tend to get the same kind of problems that our family got, but not usually all of them. But you ought to have a general sense of what these are, what runs in your family, if everybody died of a heart attack at a young age, or if everybody has, abdominal pain and had their gallbladder out, then those are important information for the doctor. You ought to know about your medical problems, why you went in the hospital if you went in, what surgery you've had, and about when it was. These are important things, once a year at that annual wellness visit to kind of get all figured out. Most doctors put them in the chart and then they're there forever because computers have good memories. but nonetheless, that's kind of where we're at. The other thing that sometimes is missing that you need to be forthright with your doctor, and he can help you, she can help you better, is if you disclose your social history. This would be who lives in your home. Are your children in town? Are they supportive of you? Are they engaged with you? Or are they just a problem for you? And we have all kinds of things, but it really helps the doctor to know a little bit about what you're dealing with, what your stresses are, and all that kind of stuff. So let's go to the next slide. At that annual wellness visit, we often talk about advanced directives. Now, advanced directives have been called a living will, but it's really about what you want done with you. So I want you to think about this for a minute. Advanced directives are there to have you decide what you want done in the end, in the last month, 6 months of your life. You should give a copy to your doctor. You should talk with your spouse or whoever your decision maker is and be clear about what your wishes are. There is a document you can get on the internet called the 5 Wishes, which is really a good document about how to go through and choose the 5 most common things that families have to go through. Do you want a feeding tube? Do you want to be kept alive on a ventilator? These kinds of things. The main thing advanced directives do is they have you, force you, if you will, to choose one of your children to carry out your decisions. This child doesn't get to make decisions. They get to carry out the ones you made. And that helps the other kids in the family or even grandkids to know that, grandma or grandpa decided that they didn't want this or that to happen. And therefore, if you're on a ventilator and the doctor who makes the decision, you need to come off the ventilator and it's time to pass. It's not the kids that feel like they've killed their grandmother by deciding to take them off the ventilator. The doctor made the decision. The children or grandchildren can agree with it, and they should agree with it based upon what your desires are, not based upon what their desires are. Otherwise, I'm telling you, I've been doing this for many, many years. As you can see, I'm gray. The idea is families get in a whole lot of conflict and guilt between the children if there's no one in charge and no one knows what to do, and they all argue with each other about what dad wanted to have happen. So, and then the other thing is these can be changed. If your condition changes and you want to update them every year, every 5 years, that's fine. So these are my last 2 slides. So let me kind of go through this and then we'll open it up for a discussion a bit. Health is a journey. So this is my best attempt at a haiku. So some people know what that is, but I tried to make it visually interesting. But anyway, health is a journey. So health is a journey taken with your doctor down a very long and exciting road. And you need to make life an exciting road. There's all kinds of things that happen. Think of your doctor as a coach on the sidelines, not someone who plays in the game. They don't make decisions. You make the decisions. They give you advice. She can't make decisions for you nor protect you from your poor choices, whether they be health or financial. Advice we give is based on science and clinical trials and experience, and you can choose to follow it or not. We expect that knowledge will change, recommendations will be updated. Very important concept. We practice medicine on the basis of science. We don't practice it on the basis of intuition or gut feeling or anything. We do it on the basis of science, but science changes. If it doesn't change, it's not science. The whole idea is to do experiments and learn from experiments, to do observation about what's happening and to change our recommendations based upon that. So you'll see immunization recommendations changed over your life. You'll see different recommendations. We stop medicines or start medicines based upon experience. It's not based upon random thought. So that is a good doctor if they say, well, gee, this thing was published in the last year and our recommendation has changed. Going down this list here, your doctor does have a perspective and a viewpoint for caring of hundreds of others on this journey. And the reason I say that is that we as parents, when we were raising our kids, had this idea that we could choose better for them, especially the young adults in your life. You know you could make better choices than they're making, but you can't. They have to be allowed to make their choice. And the reason you can make better decisions is you have a different perspective or a different viewpoint because you've lived a certain amount of life. The doctor has the advantage of going through that part of your life with hundreds of other people who are at that same point, and they can see what works and what doesn't work. However, you're protected by ethics and devotion and a commitment to improvement. So this is what our profession does: is we have a pretty high ethical standard. We're very devoted to our patients. You see these people working in the hospitals full of coronavirus at risk of their own life. And so there's a certain selection for people that go into this profession, where we raise our hand and say, we will do this. So lastly, health, and the first one started health as a journey. This is the last one. Health is a walk, a healthy meal, a conversation, and a recognition of lifetime choices. And then my last slide is what I go through with people. So this is the things that will actually make a difference in your life in terms of your health. A lot of times you're worried about whether this supplement will help or that supplement will protect your memory or whatever. And all of these other things besides these 8 things pretty much make less than 0.5% a difference, no matter what you do. But here's the 8 things that they found scientifically that actually helps. You live longer, healthy, and get you to be very healthy until the night before you die. Walking regularly or some other kind of substitute exercise. And regularly means virtually every day. Having a flu shot every year actually helps, independent to whatever else you have, but it also implies that you get immunizations. You talk to your doctor about what else is needed, and you see your doctor. Someone to talk to. It turns out that people that have someone to talk to that they can confide in, and 2 people are better than 1, you can have a spouse and someone else. Turns out that's actually associated like the 3rd most important thing in your life to extend your life healthfully. Eat less meat doesn't mean no meat, but it means, fish and chicken are better than steak and pork. But less meat in general is good. More vegetables are always good. Everything that's colorful is usually useful. We might say less sugar, but that's also important, but it didn't make the list. Routines in your life and with your activities. So doing about the same thing every day, or at least 3 days a week. You do the same thing from morning till night. Going on a walk every day, eating around the same time, going to bed around the same time every night. These are really important for the brain, so it doesn't have to do all kinds of adaptation all the time. Turns out getting about 7 hours of sleep is useful, optimal, if you will. 6 is okay, 8's okay, but 7 seems to be the magic number. Some people will peg it at 7.5, but let's say at least 7 hours of sleep every night is important. What you're doing here at OLLI is being interested in learning and growing and developing, and that turns out to be very important for your brain development. It's not as important that you do crossword puzzles, but it is important that you learn new things all the time. And then the last one is being present in your world, smelling the roses. If you go on a walk, try to understand that we live in one of the most beautiful places on earth. We're glad everybody else in America doesn't know about how great Southern California is. But, we see that on the Rose Bowl day when everything looks wonderful down here and it's snowy every place else in the country. But nonetheless, on all days, there's always some flowers blooming or some beautiful sights to see when you're out walking around. Or if you're stuck indoors, the idea is, treasure the phone conversation you have, treasure the book you read, be present in your world. Don't try to just be frustrated with everything. So, okay, well, my last slide is questions, and so I'll go back to trying to understand. Maybe we can discuss some things that you might have. I don't know if there are any, but nonetheless.
Yes, we have some questions in the chat. So if you have any questions, please type it into the chat, or you could raise your Zoom hand. Okay, the first question, are calcium supplements of any value?
Okay, so let me just do the disclaimer. Talk to your doctor about all this. I'll give you my opinion, but if you don't have dairy products in your life, then calcium supplements are helpful, particularly for women relative to bone density and all that stuff. Vitamin D is a whole bunch is more important than calcium is. But, if you don't eat any green leafy vegetables, you don't have any um, dairy products, then you probably ought to be on, 600 to 1,000 milligrams of calcium a day. That's what we generally say.
How do you know which side effects to talk to your doctor about and which ones are fine to just live with?
Mm-hmm. Well, this is a great question. Thank you. That has to do with your function. So if they bother you, then and they bother you, for instance, every day, then it's probably not a side effect you should be putting up with. But if they're very minor, they last for you know on the pain scale, if you will, from 1 to 10, and they're a 1, then you need to be very clear with your doctor as to what benefit am I getting from this medicine. And if the doctor says, well, there's not really much benefit, it's very minimal, then you may not want to put up with a 1 out of 10 side effect. But if he says, oh, there's a tremendous benefit, it's going to prevent you from having another heart attack or stroke, then it might be putting up with a 3 out of 10 side effect. So the answer to your question is what your tolerance level is, but you ought to be remembering that side effects or even long-term effects ought to be ones that are traded for a benefit that you think is worth it. So I think that can be the best answer I can give.
Okay. What is the best way for me to tell my doctor that I feel I need to change doctors?
Mm-hmm.
Or do I even need to?
Well, if you're thinking that, you probably do. I guess that you need to in this presentation, I've tried to talk a little bit about that ability to engage with your doctor and feel like you're getting some value out of the relationship, and that you can talk to your doctor and stuff. And if it's a very cold presentation, and when you go in to see the doctor and all they're doing is refilling your medicines and not really talking to you or listening to you, then you may want to get a different doctor. I think it's very important to be honest. I always say, because I'm a very optimistic guy and I tend to try to give everybody the benefit of the doubt. I think it's worth a conversation. You make an appointment, you go in, you have a visit, and say, I need to talk to you at the end of this visit for a couple minutes, 2 or 3 minutes. So would you be sure I have that much time with you? And you have your visit, you do what you got to do. And then you say, I don't think that I'm getting that much out of the visit. I don't feel like I'm able to communicate that well with you. Can you recommend somebody else who would be a good doctor for me, considering that I'm probably hard to get along with too? Take some responsibility. And they will say, oh, my associate who's new is looking for new patients, and I'm just overwhelmed, and I'm sorry I haven't been able to meet your expectation. And that would be a good experience. Or they may get angry and upset, in which case you need a new doctor. So now the other thing to do is talk to your friends and just try another doctor if you can, depending upon your insurance and everything. But another doctor, even in that group that's covering for your doctor, might be an alternative for you. But it's a difficult conversation. But I'd hate for you to. I always say this to people: if you put up with something that you're unsatisfied with, whether it be a side effect or an uncomfortable doctor-patient relationship, and 10 years later you finally, the doctor retires and you get a new doctor, and you say, "This is wonderful. Why didn't I do this 10 years ago?" I mean, it's like, do it now. I don't think it's worth suffering, but I do think it's worth having the doctor know that you're not particularly pleased, because otherwise the doctor just thinks everything is fine. So let's try that answer.
Okay. A closely related question. My primary care doctor just retired. what are your recommendations on how to find a new one? You gave us a few, but are there any more tips on how to find a new doctor?
Well, there, like I say, there's family, there's friends, and all that. But one of the other little things I say, and I'm gonna couch this in, let's say you move to a new community or something. So call your hospital you want to go to. Ask to talk to the nursing director on the medical floor, and you say to her, what group or what doctor would you recommend? I'm new to your community, or whether you are or not, or I'm looking for a new doctor. Who take what group seems to take good care of their patients here at your hospital? Because if I get sick, this is where I want to go, and I want to know who you'd recommend. And they undoubtedly will have a recommendation as a nurse, and it can just be the nurse. It doesn't need to be the chief nurse of the hospital, but just, the medical floor charge nurse. They're called charge nurses. They know what's going on. They're very good, reputable people that can recommend. They may not be able to recommend a specific doctor, but most doctors are in groups nowadays, and you can say that group has a good philosophy of care. They really take care of their patients. They're easy to get along with, and that's kind of what you want. In terms of the specific doctor, sometimes you just have to go to a couple and find out which one clicks. I have people that leave me. I think I'm the best doctor, of course, but all doctors do, and they should, I suppose. But yeah, but it's just a matter of the personality and do you like doctors that talk or doctors that don't? Okay, another question.
Okay. On telemedicine, do you encourage your patients to email you with in between visits and have a conversation with you that way?
Yeah. So we do have a secure portal at our practice. St. Joe's, St. Jude's medical groups do. And I think most doctors do nowadays, especially with coronavirus. And then in addition to that, we do televisits, which are, basically Zoom visits. Occasionally we can use the telephone if the Zoom thing won't work for you. But um, the, the, uh, the email portal is best used for you to report back on a previous visit on data, or so my blood pressure has been this and that, and you said if it's my blood pressure is high, then you wanted to add new medicine. You mentioned this or that medicine, or you said you wanted to avoid medicine, but now my blood pressure is really high. Is that okay? That kind of thing is a good message to get for me. On the email. The other email kind of thing is, I've got this pain. Do I need to be seen? I've got a urinary infection. Do you want to see me or not? Now, I do have to say that emails for physicians are kind of answered usually once a day, but maybe not for 2 days. So you shouldn't put in an email, I'm having chest pain and I really don't need to know abdominal pain. Should I go to the ER? Well, the answer is, if you think you need to go to the ER, you probably ought to pick up the phone and say, do I need to go to the ER? Not to just leave an email message. But I wouldn't do that agenda setting, activity that we talked about earlier. And these are the three things I want to talk about, except that if you want to write them down so you have them just before your televisit, say, these are the three things that I want to talk about at our televisit. It gives you a chance to organize your thoughts. And if the doctor gets that message, he can say, oh, okay, that's what she wants to accomplish during this visit. That's very appropriate. Just don't expect them to be answered by email and then turn around and have a televisit and go over the same things.
Okay, I don't see any other questions right now. Oh, one popped up. My cardiologist said that no diet will improve my blood pressure. I just need to take my medicines he prescribes for the rest of my life. How should I respond?
Okay. So here's the deal. There's only one thing that's been shown so there's a different issue here. Diet can harm you by eating the wrong things, because it puts stress
relative to cholesterol. The wrong things for diet for hearts is generally too much sugar. It's not too much fat. Although we don't want you to eat lots of, lard and red meat. But the point is that there's not that much we can do for hearts with diet, except salt. And so salt turns out to be very important with blood pressure and congestive heart failure, these kinds of things. Let me put it this way. I talked about that 2% and 0.5% benefit. If we treat blood pressure, and we get it controlled with medicine, there's a 30% less stroke and heart attack long-term, talking over 10 years. If we treat it with diet, there's a 2% advantage. So, and if you can get your same person, and one person takes medicine and gets their blood pressure control, and the other person takes diet and gets their blood pressure control, there's only about a 2% benefit in terms of preventing strokes and heart attacks. There is an independent benefit of being on blood pressure medicine. What most doctors think, my son's a cardiologist too, so that doesn't mean I know anything, but I have this conversation with him. Most people think that what blood pressure medicine does is prevent the spikes to be so high when you have, but people's blood pressure goes up and down all day long. So it prevents the spikes from happening and happening as much and as high, even though the average blood sugar or blood pressure may be, the same in a group of people that really are vigilant with their diet, people that are vigilant with their medicine. So that's why I think that there's a feeling that we can control ourselves better with medicine. But that's what we do for living, is give away pills, because we see that 30% benefit. We don't see 100% benefit. I don't want to propose to you that there's 100% benefit, but there is about a 30 to 40% decrease in long-term in strokes and heart attacks, and that's what we're after, is keeping you healthy till the moment you die. So hate to keep saying that, but I think it's important from a philosophical standpoint. Well, is that all the questions then?
Yes, that's all the questions, Dr. Smith. Thank you for presenting today. You've given us a lot to think about for our next visit.
I appreciate the opportunity.
Okay, thank you. So our next medical series lecture will be February 17th at 7 p.m. And it will be on metabolic syndrome. Metabolic syndrome is a preventable constellation of obesity, elevated cholesterol, blood pressure, which impacts all organ systems, the ultimate silent killer. So until next week, thank you and stay safe, everyone.